Hello, I'm Mansi Gawali, one of the medical student. What is your name?
Madhukar.
Okay. And what is your age?
40.
Okay. So today we are going to do examination of your motor system. So we'll start now.
Observe the patient's body position during movement and rest. Watch for involuntary movement such as tremors, tics, chorea, or fasciculation. Note their location, quality, rate, rhythm, and amplitude, and their relation to posture, activity, fatigue, emotion, and other factors. Inspect the size and contours of the muscles. The thenar and hypothenar eminences of hands should be full and convex. Atrophy of hand muscles occurs in normal aging. Observe the muscle tone by holding one hand with yours and supporting the elbow. Flex and extend the patient's finger, wrist, and elbow and put the shoulder through moderate range of motion. To test muscle strength, ask the patient to actively resist your movement. Test flexion and extension at the elbow by having the patient pull and push against your hand. To test extension at the wrist, ask the patient to make fist and resist as you press down, or ask the patient to extend the forearms with fingers straight and palms up, then press the palms downward. Test the grip. Ask the patient to squeeze two of your fingers as hard as possible and not let them go. To avoid getting hurt by strong grips, place your own middle finger on the top of your index finger. Normally, it should be difficult for you to pull your fingers from the patient's grip. Test both the grips simultaneously with patient's arm extended or in lap to help compare the right and left hand grip. To test finger abduction, position the patient's hand with palm down and fingers spread. Instruct the patient to prevent you from moving any fingers as you try to force them together. Test opposition of the thumb. Ask the patient to touch the tip of the little finger with the thumb against your resistance. Test the flexion at the hip by placing your hand on patient's mid-thigh and asking the patient to raise the leg against your hand. To test adduction at the hips, place your hand firmly on the bed between the patient's knees. Ask the patient to bring both legs together. Test abduction at the hips. Place your hands firmly outside the patient's knees. Ask the patient to spread both legs against your hands. To test extension at the hips, have the patient push the mid-posterior thigh down against your hand. Test extension at the knee. Support the knee in flexion and ask the patient to straighten the leg against your hand. To test flexion at the knee, position the patient's leg so that the knee is flexed with foot resting on the bed. Tell the patient to keep the foot down as you try to straighten the leg. Test foot dorsiflexion and plantar flexion at the ankle by asking the patient to pull up and push down against your hand.